With the conclusion of the 10th week of the 2018 Kentucky General Assembly, policymakers have begun to narrow their focus as 13 legislative days remain before the end of the regular session. Member action is required to ensure the last few weeks in Frankfort are as productive as possible. A KMA priority related to administrative simplification may come up for a hearing by the Senate Health and Welfare Committee this week, and KMA members are being asked to mobilize on this issue. House Bill 69, sponsored by Representative Ken Fleming, would require the Department of Medicaid Services to designate a single credentialing verification organization to verify credentials for DMS and all Medicaid managed care organizations. The measure would also streamline provider enrollment and credentialing procedures, as well as the written internal appeals process utilized by MCOs. The bill passed from the full House 2 weeks ago by a vote of 94-0. KMA members are urged to call the legislative message line and request that the members of the Senate Health and Welfare Committee support this bill. KMA has joined numerous other organizations in urging members of the Senate Banking and Insurance Committee to give Senate Bill 143 a hearing soon. Senate Bill 143, sponsored by Senator Ralph Alvarado, would enhance access to prior authorization information, establish one-year approvals for chronic disease medications, prevent retroactive denial, enhance the review process, standardize review times, and increase access to electronic prior authorizations. This bill would remove several roadblocks for patients trying to access medications and treatment and allow providers to make decisions regarding care instead of insurance companies. Supporters of Senate Bill 143 include the Kentucky Hospital Association, the American Academy of Pediatrics, the American Lung Association, and the Kentucky Hemophilia Foundation. Please call the members of the Senate Banking and Insurance Committee and ask them to support Senate Bill 143. Finally, KMA members are reminded to continue contacting their representatives in support of Senate Bill 20, which passed through the full Senate 2 weeks ago by a vote of 20-16. The Omnibus Medical Malpractice Bill will require an affidavit of merit at the time a claim is filed, would place caps on plaintiffs' attorneys' fees, and prohibit expressions of sympathy, compassion, and benevolence from being used against a healthcare provider in medical malpractice claims. Senate Bill 20 has been referred to the House Judiciary Committee and awaits a hearing. Please call your representative and ask them to support Senate Bill 20.